Hello and a very good afternoon to all of you. I'm Sayukta, your host for today's live from All About Skin Wellbeing team, and I'm sure all of you must be doing good. Today we are going to discuss about our skin health with focus on urticaria or hives, which we or our near and dear ones would have encountered at some point of time in our lives. Urticaria is classified as acute and chronic, but the most important part is not to ignore it, and doing self medication can actually worsen the symptoms. Consult your nearby qualified skin specialist immediately for an early relief. As you know, in today's digital world, it's a boon or blessing if we can get to hear from an expert dermatologist online about urticaria and its types, how we can prevent it, the kind of test required for its diagnosis, the right treatment and management approach for an early relief. So, ladies and gentlemen, girls and boys, we have with us renowned dermatologist Dr. Prachi Prashant Mahajan, who is MBBS DDV from Mumbai and is a skilled dermatologist, dermatosurgeon, and cosmetologist with advanced training in aesthetic medicine. She completed her postgraduate training in dermatology, venereology, and leprology at Dr. Balabhai Nanavati Hospital, Mumbai, and earned her MBBS from Dr. Vasant Rao Pawar Medical College, Nasik. Additionally, she holds a fellowship in aesthetic medicine from Disha Skin and Hair Institute, Thane, and internship from GS Medical College and Care Hospital, Mumbai. She is proficient in diagnosing and treating a wide range of skin, hair, and nail disorders, as well as sexual transmitted diseases and leprosy. She is also highly skilled in performing dermatosurgical procedures, biopsies, nail surgeries, cosmetic treatments, bringing both precision and care to her practice. A very warm welcome to you, Dr. Prachi Prashant Mahajan.
Thank you for warm welcome, Sayukta. It's a pleasure to be on the show. Yeah.
It's a pleasure, Doctor, to have you with us. And it's so important to talk about such topics, especially urticaria, because it's quite common and still we are not that much aware about it. So, Doctor, to start with, what is urticaria? Urticaria hota kya hai?
Urticaria is basically a skin reaction. It is not a disease or it is not an infection per se. It is a skin reaction which a body mounts in response to allergen. Okay. So whatever thing is going, so body, if some allergen or a pathogen gets inside the body increases its temperature to kill the allergen or pathogen. Okay. So urticaria is also that only thing. It is in response, but it appears on skin. Okay. So in the form of rashes or hives or wheals. So that is basically urticaria.
Okay, Doctor. Doctor, how does it looks like as a layman, as a commoner? How do we know that whatever is happening is urticaria?
First of all, there will be a slight sensation that something is going wrong with me. Some pricking sensation, some heat sensations going inside the body. So that will be there. Apart from that, after some time, the patients complain that they first there was a feeling of itching. Okay, then the patient actually starts itching, scratching, and also starts developing wheals and flares on the any area of the body. Okay, so also it can that is the term is called dermographism. That is in the direction the patient is itching, there will be scratch marks which will remain it for some time, maybe some minutes, some seconds, or maybe an hour also. Okay, so that is called dermographism. So yeah, so this is a manifestation. In severe cases, the patient can also have angioedema, lip swelling, in that is, and also earlobe swelling, eyelid swelling, or genital swelling. So that can also be manifested. In very very severe cases, patient can also develop windpipe obstruction, that is difficulty in breathing, also difficulty in swallowing. In yeah, so it depends on the severity, the symptoms and all. Yeah.
Right. Doctor, what causes urticaria? What all reasons are there which can lead to urticaria?
So there are severe reasons which leads to urticaria. First and foremost, urticaria, we can actually classify urticaria first as in acute and chronic. So depending on that, the causes can be categorized. Okay, so first is acute urticaria. It is like urticaria which is developing just in seconds or just in minutes. So a particular patient has gone to some restaurant, or is passing through some place, and suddenly he starts getting itching or rashes on the body. So that can be urticaria due to pollens, or urticaria maybe because of allergy, because of eating some food which the patient has not tried earlier. Okay. Or urticaria, or he or she might have tried earlier, but that time the body has not mounted a allergic response, but this time the body is the immunological response are hyperactive. So in that case, that particular person might manifest the disease. So it can be acute urticaria, it can be chronic urticaria, which is lasting for more than 6 weeks. So urticaria can be, actually the term we can say, anything under the sun, including the sun, can cause urticaria. Okay. Now why I'm saying this thing, because why sun causing urticaria, because there are certain reactions which occur on the body when the patient is going in sun or hot weather, or on a beach holiday or somewhere. They might not take the precautionary measures like applying of the sunscreen, or wearing the protective clothes, okay, covered clothes, or wearing a hat or a sunglass. So because of that thing also, patient can develop urticaria. That is because of sun. Okay. And under the sun, anything like pollens, or if the particular person is in a cold atmosphere, or intolerance to cold, that can lead to cold urticaria, or heat urticaria. So yes, that is there. Some people might develop urticaria when just taking a bath with very very cold water, or very very hot water. So in that case also urticaria steps in. So there are multiple causes
Right.
and multiple types of urticaria. Pressure urticaria is also there, like wearing a tight wrist watch. Okay, so that might also give rise to urticaria. Yeah. Or wearing some clothes which are newly ordered from the shopping websites, or taken from this shops. Just one, yeah, or taken from a shop or anything without washing, then just wearing the same. That kind of the synthetic, the fiber in that particular cloth, which is already pre-treated with some gel or something, that also might give rise to urticaria. Yeah. So
Right.
it can be
So
chemical
any number.
urticaria in that case.
Yes, yes. So n number of things can trigger urticaria. Doctor, is it a kind of allergy?
It is a response. Urticaria is basically a response to allergen.
Hmm. Doctor, are there any potential complications of urticaria if left untreated?
Yeah. Urticaria, if see, the patient will not sit only in one place without uh, treatment.
Hmm.
It is very uncomfortable that the patient is getting urticaria, continuously itching sensation, continuously burning sensation when in the office or in the workplace, is or students while studying. So it is making the life more disturbed. Okay, so that is going to create so much of disturbance in day-to-day activities, that it should be treated on time. Otherwise, it will lead to certain complications, like initially the patient is having just skin rashes. Okay. Localized to particular area of the body. If that skin rash is just ignored, okay, then it might spread to other areas of body. It is not infection, but it is a allergic response, it is an immunological response. If that immunological response is not settled, or is not made to settle by a doctor, then it might spread to other areas of the body, and it is very severe. Lip swelling, controlling lip swelling is very very severe. Eyelid swelling,
Hmm.
the patient might have difficulty in there might be vision obstruction also because of that. Plus it is very, it can lead to super added infections also. It is not an
Hmm.
infection, but it can lead to super added infection.
Right. And as
Because of
you said
itching
that.
and scratching, because of itching and scratching, the skin in there might be a disruption in the skin. Epidermal lesions can be there, the scratch marks and all that can lead to secondary infection.
Hmm. Right. And as you were saying that, many a times swelling of the skin lips or throats or tongues can happen, and that can lead to a difficulty in breathing. And recently we have heard such a news where a big celebrity businessman collapsed while playing polo because there was a he swallowed a honeybee and there was anaphylactic shock, etc. So it can be dangerous as well, so it's always a good idea to get it treated, to see your doctor as soon as possible. Now,
Also,
doctor,
just 1 minute. If you allow me, just 1 minute, I would like to talk on one particular thing that I just got. I just get many of the cases when I'm seeing the pediatric patients, the pediatric urticaria patients. That time, I have seen through my practice that I get many of the patients who tell me that doctor, we have started. I have to ask now to the pediatric patients because I have only got to know from them only. See, weaning period is mostly around 6 months we start weaning, okay, of a baby. But then some patients are so keen on breastfeeding that they only breastfeed their baby, maybe to up to 1 year, up to 1.5 year. So they keep on doing that things. They don't introduce the food to them at a particular, at a right age, which is actually should be done. So the weaning period is getting postponed in some patients because of the, in some individuals, in some babies, that itself is these type of babies are more prone for urticaria in later life. I'm not saying only these patients, but yes, many of the pediatric patients, when I ask the history now, they are giving, some of them give the same history that we have started weaning at this age. I have to ask now the patients that. And also the patient should start weaning at 6 months, because the earlier you start the foods, the earlier you incorporate the healthy foods apart from breastfeeding to the babies at 6 months, obviously 5.5 to 6 months only. But then these are going, the patient's immunities are getting, they're getting used to all these things like dal or
right.
some kimchi we say, or rice which is in the mixer or something. So the patients, they
Yeah.
are the babies, they are getting used to all these things at the early stage, okay, which is actually going to build the immunity strong. And yes, the chances of urticaria are eventually going to be reduced, and if in case they are getting, it will be in a controlled manner.
बिल्कुल, और इसीलिए डॉक्टर्स पीडियाट्रिक कहते भी हैं या गायनेकोलॉजिस्ट कहते भी हैं कि 6 महीने तक तो ब्रेस्ट फीडिंग बहुत ज़रूरी है, लेकिन उसके बाद धीरे-धीरे बच्चों को जो रूटीन
Correct.
का खाना है, दाल का पानी, चावल का पानी, खिचड़ी, दलिया, इस तरह से उनको इंट्रोड्यूस करना ज़रूरी भी है। Now, doctor, you also mentioned that there are two categories of urticaria, acute and chronic. You have explained a lot about acute, और acute को समझना लगता है कि थोड़ा सा आसान है, but we would like to talk about chronic urticaria more here, because many of our viewers keep on asking क्या urticaria जो chronic है वो कभी ठीक होगा, completely cured होगा. So this is a very common question patients often ask. What's your take on that?
Yeah. Actually, with a heavy heart, and I would like to tell to all the viewers with a very heavy heart that urticaria is something which is going to be allergic. Okay, so if suppose, if we'll take my example, if I am allergic to dust, okay, actually I am allergic to dust. If I'm going through a particular place in which there is a lot of dust, okay, then I am supposed to wear a mask and go. I know that I'm allergic to dust. In spite of knowing, also I'm not taking the precautionary. So these chronic urticaria patients, they basically know to what things they are allergic to. Okay, so like me, I know I'm allergic to dust. Okay, so I am going to wear a mask, and I'm going to clean, or I'm going to go through a particular place where there is a lot of dust. And I'm going to take a precautionary measure, and I'm going to go there. Otherwise, I will start sneezing like anything, and then 50-20 sneezes, and then I'm okay. So this thing is going to happen with me, I know this. Okay, so chronic urticaria patients are knowing. There is with a heavy heart also, that I wanted to say, there is no cure for urticaria. Okay, it is like diabetes. Like diabetes, we don't have cure. Okay, we just can keep the diabetes under control. Like
Right.
psoriasis, we just have to keep the disease under control. Okay, it completely goes off if it is kept under control. But 100% cure, there is no documentation anywhere in the books that psoriasis or lichen planus or urticaria is curable. That is not there. It is not an infection, so that will give some medicines and it will cure off. It is not going to happen. So it has to be kept under control, and keeping under control is on the patient side also. He or she has to take precautionary measures also, whatever he has been told to by a dermatologist is. And also he has to give proper history when he's talking to a dermatologist. Observation is very very important. Patients are supposed to know through to these things कि उनको सपोज इनको सी फूड खा के या फिर मशरूम खा के ऐसे खा के उनको एलर्जी हो रही है. सो दे शुड नॉट
Hmm.
जंप इनटू दैट. यू नो टू व्हाट एलर्जी यू आर नॉट सपोज टू ईट दैट फूड. ओके, इट इज
Right.
नॉट दैट कि मैं खा के देखूंगी, देखते हैं होता है या नहीं. ऐसा नहीं करने का है. इट्स लाइक कमिटिंग सुसाइड. यू नो दैट योर इट्स नॉट गुड, देन ऑल्सो यू आर डूइंग इट. ओके,
Mhm.
so you
True.
need to avoid that things if it is already noticeable to you, or else
Hmm.
there are certain tests also which are comprehensive allergy panel test. Everything under the sun, including ink, can be tested to what type of allergies you are. Okay, so but that unnecessary. I'm not prescribing to each and every patient of urticaria visiting and walking in my OPD comprehensive allergy panel test. That test we only give to the patients who are not able to manage their routine properly. The urticaria is causing disturbance every minute, every second, every hour to that particular person. Okay, there are mostly almost 5 times in a month the patient is having urticaria. In that case, it is a doctor's duty to find out to which allergy, to which particular food, medicines, or pollens or anything the patient is allergic to. Okay, so that has to be investigated properly. Hence it is very important to visit a dermatologist when the lesions are less severe. It is the patient should not ignore the urticaria lesions, because it might be severe. And also you said about the very famous celebrity, it can also cause death. Okay, so it need not to be ignored.
Right. We have seen, it's so common in our society. Maybe one of the biggest reasons is that it's easily accessible, available, and that's over the counter medication. We have so many chemist shops, and whenever we see something on our skin, we are so lenient with our skin. First of all, we'll go and consult, rather than consulting a doctor, we'll go and, to any chemist shop कि भैया कुछ हो रहा है, खुजली हो रही है, रैश हो रहा है, एलर्जी हो रही है, कुछ दे दो. And we'll keep on taking the allergy, anti-allergic pills, और उससे थोड़ी राहत मिलती है तो हमें लगता है कि ठीक है, बस हो गया, हमने मैनेज कर लिया. We normally at the very first go don't line up in front of a doctor. I don't know what pleasure is there in that, but we'll keep on suffering in silence. All we'll do over the counter self medication, but we takes time to go to the expert doctor, especially in case of skin. I'm sure you also have seen patients who come to you कि नहीं पहले भी हुआ था, हमने एंटी एलर्जेंस ले लिए थे या केमिस्ट शॉप से कुछ ले लिया था, एंड देन दे कम एंड कंसल्ट यू. Is it a common sight? होता है ऐसा, and what's your advice on that?
See, there are, see, we are the last person whom the patient will get. Pehle, they might give a history of, going to a chemist shop or going to a Baba or somewhere, getting some chandan ka lep or something like that type of patients also we get a lot. Okay, so they have tried everything. Okay, but then these Babas and these chemist people, they don't properly guide the patient. They don't refer them to a particular doctor because they themselves want to treat. Everybody is very very talented. They think that they can treat it, but then it is not like that. They are basically they are not guiding them properly, and they are actually increasing the risk for severity. So chemist shop also, some lotion, some application, they might feel better for 2 3 days, but then again they will start getting the thing. So it is better to consult a doctor rather than concerning some quacks or these type of chemist. Chemist job is only to give medicines, and the patient should really understand about this. They are not actually bound for consultation. So consultation to proper dermatologist is very very important.
Hmm. Now, doctor, there's one thing, for instance, say I'm allergic to nuts since childhood. मुझे पता है कि nuts खाऊंगी तो allergy होगी. But many times, what happens, say I'm not allergic to seafood, and suddenly I realize that whenever I'm consuming seafood, I'm getting these urticaria or getting lesions. And when patient comes to you for diagnosis and treatment, are there any way to फाइंड आउट और एनालाइज कि किस वजह से हुआ होगा, क्योंकि इतने सारे ट्रिगर्स हो सकते हैं, एज यू सेड, एनीथिंग अंडर द सन एंड इवन द सन कैन कॉज अर्टिकेरिया. सो कैसे एक पेशेंट भी समझे कि उसने ऐसा क्या किया जिससे ट्रिगर हुआ.
So a proper history taking is very important in case of urticaria. So I have to spend literally around 20 minutes with my urticaria patient to actually get the history कि क्या हुआ था, कब हुआ था, entirely 1 week, 1.5 weeks से उनके साथ क्या हो रहा है. Entire history taking is a very important part in case of urticaria patients. So that history taking is actually important. So with that detailed thing we can get to know that people say that now कि हमने नट्स खाए थे, हमेशा नट्स खाते हैं कुछ नहीं होता है, इस बार खाए प्रॉब्लम हो गई. So might be this time the body has mounted response ki now that can happen. Okay, so we also have to counsel the patient also in that case ki abhi kyun hua, because body has mounted. Every time I have to give the weird example of an alcoholic person. The patient is having alcohol for long duration of time. He is okay, he's fine, he's happy or sad, whatever, he's taking alcohol. At one particular, after some years or after some time, the patient starts developing, his liver is getting damaged, his kidneys are getting damaged, his overall health is getting damaged. So it is not going to happen suddenly. All things doesn't happen suddenly. Some urticaria triggers might take some duration. Okay, so this example I have to give. And for those people who are saying पहले हम बहुत बार खा लिए सी फूड तभी तो कुछ नहीं हुआ डॉक्टर, अभी कैसे हो गया. Okay, so that I have to explain them in that sense.
So history taking is the only way of diagnosis, or there are tests, etc., that you normally recommend for urticaria?
Yeah, initially patch test was done in for urticaria, dermographism. Clinical diagnosis is very very important. Clinically, we can diagnose urticaria very nicely. Okay, so yes, wheals and hives will be there. Angioedema will be there. Earlobe swelling, eyelid swelling, vaginal swelling, vulval swelling. These might be there. Dermographism also is seen in many 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 patients of urticaria. Okay, so that might be there.
Hmm. Okay. And what is the line of treatment, doctor?
Line of treatment can be depending upon the severity. So depending upon the severity we can choose a moisturizer or which is already having the anti-inflammatory properties, or steroid lotions. Okay, that we can mix with moisturizers and then we can advise the patients. Sometimes we also have to treat urticaria little aggressively. We have to give injectables. So injectable in the form of anti-allergic injections. Some oral corticosteroids are supposed to be given if the severity of it, if the urticaria is very very much severe. So depending upon the severity we can treat urticaria.
Okay. Doctor, can urticaria be caused by stress?
Yes, urticaria stress is basically what stress is going to do. It is going to increase the cortisol levels in the body. Now, when this cortisol component is increased in the body, it causes the histamine to release from the histamine from the mast cells it get released, and the thing that is cortisol production and histamine release and urticaria. All these things are directly proportional. मतलब जितना cortisol release होगा उतना ज्यादा histamine release होगा मास्ट सेल से, उतना ज्यादा स्ट्रेस भी बढ़ेगा और उतना ज्यादा अर्टिकेरिया के जो लीजन्स है बॉडी में वो आएंगे. सो ऑल दीज थिंग्स आर डायरेक्टली प्रोपोर्शनल टू ईच अदर, वेरी वेल रिलेटेड. स्ट्रेस.
Okay. Now there are so many questions we are getting from our viewers. I'll take few of them. Amit Jatav का सवाल है, what precaution should we take this monsoon to avoid urticaria? Monsoon में भी क्या कुछ trigger factors होते हैं, डॉक्टर?
Monsoon trigger factors like not exactly we can say, but yes, it can be because of certain foods. food products causing urticaria. Okay, some dust causing urticaria. That might be there. Yeah.
हम्म
It is
एक
not a
सवाल है।
infection, so it will not. It is not related basically to any fungal infection or something. So monsoons per se exactly we can't say कि monsoon
हम्म
में allergies ज्यादा होंगे.
मेरी
Yes.
फंगल इन्फेक्शन का खतरा ज्यादा होता है
Correct. Correct.
मॉनसून। राइट नाउ शशि सोनी इज हियर। उनका जो सवाल है ये स्किन से रिलेटेड कुछ भी इशू हो उसमें एक बहुत ही आम सवाल होता है, एनी होम रेमेडीज टू प्रिवेंट अर्टिकेरिया। कई लोग कुछ ना कुछ लगाने पे बड़ा विश्वास करते हैं, बहुत ज्यादा इचिंग हो रही है एलोवेरा लगा लो या टर्मरिक या कुछ भी मलाई लगा लो, तो अगर अर्टिकेरिया में ऐसा करते हैं तो उसका कोई फायदा है या नुकसान?
सी देखा जाए तो फायदा तो बिल्कुल भी नहीं होता है, ऐसा तो मैं नहीं बोलूंगी. बिकॉज समडे व्हेन वी वेर आल्सो यंग आर व्हेन वी यूज्ड टू हैव इचिंग, ओके, दैट टाइम आवर dadi nani they also used to go down, take some aloe vera leaves, come up, and then they used to apply it on the skin. So जिसको फायदा हो गया उसको तो फायदा हो गया, लेकिन जिसको फायदा नहीं हुआ उसमें जो सिवियरिटी होते हैं that are not good. So why unnecessary to experiment the things when we have the facility of going to a doctor?
राइट
सो वाई अननेसेसरीली सी देखते तो हम यही सोचते हैं कि चलो करके देखते हैं क्या फर्क पड़ता है, क्यों जाना है, क्यों 500,000 रुपया खर्चा करना है डॉक्टर के पास जाके. बट ये 500,000 खर्चा करने के लिए सोचते हैं कुछ लोग, बट देन दिस टर्न्स वेरी मच सीवियर दैट दे हैव स्पेंडिंग एक्चुअली लिटरली मोर. ओके, सो कंसल्टेशन इज वेरी इंपॉर्टेंट. ओके, सो और ये जो है गार्लिक या फिर सम किचन थिंग्स लाइक टर्मरिक एंड ऑल. See, haldi is antiseptic. When we were also young, when we were also kids, that time कुछ भी लग जाता था, चोट लग जाती थी, हल्दी डाल देते थे. हल्दी is an antiseptic thing. Okay. But then the thing is that the haldi which we are getting now is very little different from the haldi which we had some 30 years back. Okay. So 25, 30 years back. Now it is all adulteration. So much of adulteration is there. We don't get actually the pure things now. So that can also lead to allergy. That can also increases the chances of allergy. So home remedies, ठीक है, you are doing, if you are getting urticaria, so if you are doing icing and all, that is okay. Okay, but then just to अभी रात में अचानक से एलर्जी शुरू हो गई, where who which dermatologist is going to work at 11 o'clock and 12 o'clock in the night? So till that time, taking a small antihistaminic or whichever is available, levocetirizine. Actually, it cannot be taken, but then plain levocetirizine can be taken in just to get a peaceful sleep for 5 to 6 hours, and then morning to see a dermatologist. I'm not saying that कुछ भी नहीं करने का, लेकिन a plain antihistaminic can be taken for time being, okay, and then as soon as possible a dermatologist should be located and they should be visited to them.
राइट डॉक्टर, एनी डाइटरी प्रिकॉशंस डूज एंड डोंट्स फॉर पेशेंट ऑफ अर्टिकेरिया, क्या खाए क्या नहीं खाए?
ये तो पेशेंट ही बता सकते हैं अच्छे से, क्योंकि कैसे पेशेंट दे लिटरली, सम पेशेंट्स लिटरली नो कि डॉक्टर मैं जब भी उड़द की दाल खाती हूँ, मैं जब भी तूर की दाल खाती हूँ तभी मुझे प्रॉब्लम होती है, नहीं तो आई एम ओके, आई एम फाइन. सो दिस एक्चुअली वी गेट टू नो फ्रॉम द पेशेंट्स ओनली कि दे आर एलर्जिक टू पर्टिकुलर मेडिसिन. डॉक्टर मैं जब भी सी फूड खाती हूँ, जब भी मैं पॉपलेट या बोम्बिल या फिर बॉम्बे डक खाती हूँ तो मुझे कुछ तकलीफ नहीं होती. प्रॉन्स खाती हूँ तो मुझे बहुत तकलीफ होती है. क्रैप खाती हूँ तो मुझे मेरी हालत खराब हो जाती है. तो देन वी हैव टू टेल, अगर आपको मालूम है तो आपको वो अवॉइड ही करना है. So that particular
राइट
do's and don'ts we get to know from the patients itself. Okay, there is no something like that I there is no some certain generalization that तुम्हें दाल नहीं खानी है, तुम्हें ये नहीं खाना है, तुम्हें वो नहीं खाना है. That basically, if you're trying something new dish, I just want to give a small advice that if you're trying some new dish which you have not tried it any time, just only try it. Don't eat it for to complete your
कंज्यूम द होल ऑफ इट, राइट।
पेट भर के मत खाओ. ट्राई कर रहे हो तो थोड़ा सा ट्राई करके देखो, and then you after 1 2 days you will, if you are actually allergic to that particular thing, you will be manifesting it. Okay, so that is there. If trying some new dish, just try it. Don't fill your hunger with that. That is okay, that should be
राइट
taken.
And Dr. Prachi, before we sum up the whole session, any take home message for our viewers?
Yes, urticaria is an immunological condition actually. We can't change the immunology in particular patients. Okay, that nobody can change. We don't have that at power to change the immunology of a particular patient. But yes, urticaria when it's diagnosed, when it is diagnosed easy by the doctor, for that the patients are supposed to visit a dermatologist that basically can keep it under control. And the patients can really lead a very healthy and a happy life. So I would like to tell that self medication, please don't do it. Self measures, home remedies, try to avoid it and go and visit a dermatologist so that your urticaria can be surely kept under control and then you will lead a healthy and happy. Thank you.
Thank you so very much, Dr. Prachi Prashant Mahajan. It was wonderful talking to you. Thank you for your
Yes, very
valuable
much
time and making this
pleasure.
whole session so informative. Thank you, Doctor.
Thank you, madam. Thank you.
And viewers, thank you for your excellent participation. For more information and updates on how to keep your skin healthy, do like and follow our FB page, all about skin well-being. We are also available on YouTube, Twitter, and Instagram. Thank you and have a great day ahead. Goodbye.